HCG is a hormone medication often administered as a subcutaneous injection. It's important for you to know how to correctly mix and administer HCG to avoid harm. Today I'm going to walk you through the different steps in preparing your HCG solution. This will prevent you from opening the packages and needles too soon and from potential contamination. Inside each 1-month kit, you should have the following: 1 box of HCG, 1 bottle of bacteriostatic water, 25 alcohol wipes, 1 5 milliliter mixing syringe, 25 1 milliliter mixing syringes, and 1 bottle of Vidcofil branded B12. This is a 1-month kit. If you have purchased a 2-month kit, you will have all of this times 2. With a 3-month kit, you'll have all of this times 3. Next, we are going to use an alcohol pad to clean the tops of everything that we're going to be using, to be sure that everything is clean and sterile. So just take a little alcohol pad and wipe everything down. Next, we're going to take out our mixing syringe, and we're going to withdraw from the bottle of bacteriostatic water what we will not be using. To define that, we need to remove about 25 milliliters. We're only going to be using 5, and this is a 30 milliliter bottle. We understand it seems a little wasteful. The new bottles will actually only have 10 ml. Now, it is very important to remember to push in the same amount of air that you're going to be removing in milliliters. So first we're going to push in about 5 milliliters of air into the water, and then we're going to go ahead and withdraw the 5 milliliters. And if you get a little air in there, it's okay. We're going to go ahead and do this again. There we go. Now we're going to be disposing of about 25 ml, and what you're going to do is just set it into a dish on the side. I've done that over here. Now if you're removing this about 5 ml at a time, remember that it will then take 5 times to get out what you're not going to be using. Once you're down to the last 5 ml, we're going to withdraw 2 ml more. What I've already done is I've pushed in 2 ml of air, and I'm going to go ahead and withdraw 2 ml of the bacteriostatic water. Next, I'm going to take and insert the 2 ml of bacteriostatic water into the HCG bottle. I want it to run in at an angle, not directly on top of the powder. It's going to be a little cloudy at first. That's okay. We're going to help it dissolve just by rolling it around in our hand. Remember not to shake it at this point. It will dissolve. Just give it about a minute or so. Once it's clear, we can go ahead. We're going to push in 2 ml of air, and then we're going to withdraw the 2 ml of the mixed HCG. Perfect. And then in our last step, we're going to take the 2 ml of mixed HCG and dispense it back in with the remaining bacteriostatic water. And there we have mixed 5 milliliters of HCG ready for dosing. In our concentration, we have 5,000 IU of HCG and 5 milliliters of water. When we withdraw in the syringes, each unit is worth 25 IU. If you look, you'll see 5, 10, 15, those are units. There should be a minimum of 5 units equivalent to 25 IU up to 40 units equivalent to 250 IU, since each one is worth 25, 50, 75, 100, and so on. This is very important information for dosing purposes. There are many areas in which you can administer your HCG. If you're going to be doing it in the abdomen area, you can simply pull up your shirt, find your abdomen. You will then pinch the skin where you will be administering it. You will take the tiny needle, which is so great. These are small needles, therefore they are very comfortable when administering. You will then insert it just beneath the skin. You can easily pull out a little bit just to make sure you're not withdrawing any blood. If you are, just reposition the needle so that it is beneath the skin, and then you are free to administer your HCG.